Today is Tuesday, August 14th, 2012. The time is now 5:33, and we are going to begin the SBCISD Board of Trustees workshop. Item number 1, call to order. Roll call, and we do have a quorum. Item number 2, presentation and discussion of proposals for third-party administrator and for the corresponding voluntary plans.
Thank you, Madam Chair. At this time, we'll ask for Mr. Hilliard. Janie, if you come forward, please, and do the presentation. This is not for the major medical. This is for the cafeteria plan, third-party administrator and corresponding voluntary plans. Do you have handouts for the board?
Yes, I do. You've got the handouts?
What we tried to do too, we present this, you can receive a flow chart. I think there was some confusion last time on how the stuff flows and maybe even a mix-up on between this and the medical. So we're going to give you a flow chart first on the voluntary plan, how it works, make it real simple. And then we have another flow chart, flow chart we'll give the medical with the simplified as well.
Oh, I need to put that too. It's all right. You need one check.
Okay, on the first page of the handout there, Ms. Gonzales, we have is this what referred to as the basket?
Yes, sir.
Yes.
That's correct.
That's a TPA.
What? No, I got it. Why don't you get over here and get it?
If you will also notice, members of the board, on the second page of what we'll send out to you on the Friday update, there's just third-party administrators with no names by them. One of the handouts that you received today is the third-party administrator and who submitted them. So that would replace that second page that you have in your handout that was sent out on Friday, which is this one here. Okay. Go ahead.
Well, before we get started, I just want to take the board, with your permission, just quickly through the process, because I want to make sure everybody understands how we approach this project, who is involved, and how we came to make a recommendation to the board, okay? So I'm hired to do the RFP, some of the information that goes in the RFP, to oversee the project, and to work with Janie, Adrian, and Lucy, okay? And those are the people, particularly Janie and Lucy, obviously, that work with these plans, okay? So the bids come in, I take a look at them, I put them on a spreadsheet, and then we start disseminating how they're set up together as a group, okay? I want to make one thing clear. I personally, not that I'm opposed to it, but I personally did not make a recommendation on any of these products as an individual, okay? Both Janie and myself and Adrian and Lucy looked at all these products as a team, reviewed them, re-reviewed them, reviewed them again, and came up with a group recommendation. And then we presented that recommendation to Mr. Lamone for his approval. That generated the information that you y'all had last time, all right? So then y'all said you needed more information. Great, no problem. And so we provided in the Friday packet, and we have some updates for you today. So I just want to make sure that everybody understood exactly how the process went and how we came up with making a recommendation to y'all on this procedure, okay? Any questions on that?
I have a question. I know we received the revised documents, and it says it's revised 8/14/12, and the Friday update is dated 8/10/12.
Yes.
Why was it revised if the information had already been sent out on Friday?
This morning, when I got here about 9:30, and Janie had a note from Mr. Lamone that he had 3 products that he would like us to take a look at that he required, and it's great, no problem. So in reviewing those products, and we'll get to them one by one, we did find some changes that we needed to make for a couple different reasons, and I'm going to go into detail on each of those, what happened, exactly what happened, and why those changes are made. And certainly on those, especially if you have any questions, feel free to ask me why, if you don't understand, because I think we all have a cloud over us. I know I certainly do, being in the paper and all. So what we want to strive for is to make sure that everybody here has all their questions answered. We want to be a clean slate, an open book, and that's what we want to leave here today, heading into the board meeting, that everybody feels satisfied that we did our job properly, we did it correctly, and you are getting the information that you requested, especially based on last time. So, did that answer your question?
Well, I'm just concerned because you said you received those 3 products this morning,
I didn't receive
or the proposals?
Okay, did not receive the 3 products this morning. We already had them in-house, and it was simply, they're not on the spreadsheet that we showed, and the question is, why were they not on the spreadsheet? And so each of them have a different reason, and we'll go through those, but that was why the question was asked.
So they did fall within the time?
Oh, absolutely, absolutely. This is not additional information that was not submitted with the proposal. There are some clarifications on stuff. One, we'll get to it, but one was mislabeled. One I just missed, and we put it in there. It didn't affect the material recommendation at all, but it is additional information in there. And then one was already on the list. I don't know why I was asked, but we did double check the rates on that one, and we made sure those rates were accurate just to make sure, and it was. So really we're talking about two different product issues, but 3 were brought to my attention via Janie to take a look at. Does that answer your question? Okay. Let's just go through the flow chart really, and once again, in interest of accuracy and make sure everybody's on the same page. We're talking about the cafeteria plan, and it simply goes to an agent, whoever handles your enrollment. We spoke before that we certainly recommend you pick an agent, one agent to do the enrollment, because it's very cumbersome both for the staff here if it's not handled that way, and it's very confusing to the employees in general to have multiple agents on a project of this nature. So you certainly have the ability to disagree and to change that if you want to, but once again, that's our reasoning on making that recommendation. And you simply see the products that fall under the agent. So this is real simple flow chart, and this is just for the voluntary plan that we're talking about today. Okay, anybody have any questions on this? Okay. Okay, we also, the next thing I want to show you is, once again, in the interest of transparency, this page that's in your document that you received Friday. Did y'all see this? This was in there, wasn't it, Mr. Lamone? It wasn't, is this new? Okay,
Was
let's
it?
pass it out.
Yeah, I've got some copies here.
Okay, what we did with, once again, with some of the confusion last week is we wanted to make, basically what you're seeing is every single product that was presented by every single agent, and you'll see that some projects will have 2 or 3 agents on it, some will have 1. You can see the difference.
Let me see, I don't have another set.
So this is really just for backup for you to see, hey, we did look at everything, who's on it. If y'all have some questions on it, I'd be more than happy to discuss it with you, but it really doesn't have a bearing on what we're going to do today. But once again, if you guys think it does, we'll go over it. Okay, the next one is, I was asked by Mr. Lamone we had showed the TPAs that was presented, and we revised this today, and all we did is we wanted to put the fees on these pages along with the agents. So if you take the first one on the left, you can see it's David K. Young, which is our recommendation, and it was submitted by 3 agents, Bob Trevino, Salazar Insurance Group, and Albert Salinas, okay? And you'll see where it says no charge with products. Okay, in his proposal, he gave a fee and said we'll waive it if we have the products, okay? And then what you'll see too in these other ones, except for Mr. Paul Turner, it's $1,800 per year. That's actually how they answered the proposal. So it's not like $10,000 / waived. It's we don't charge anything if we're awarded the products. So nothing withheld there. That's exactly how it was read, and that's how we transmit it to this page. And you can see that, you know, they're all good companies. We recommend that you stay with David K. Young because they're doing a great job. The district's very familiar with their processes and their procedures and is happy with them. And once again, it's to no cost to the district. Okay, the next page is the vision insurance. Is that in order for y'all?
Might not be in order because
Okay.
there's extra copies. They can go skip to the vision.
We'll do the revisions last, if that's all right.
The vision plan.
Let me see.
Yes, the one I just gave you. The ones I just gave them. Those are accurate feet.
So no additions on this. This is what we're looking at. And what you can see is the recommendation on Davis Vision is based on the price and the product that we feel like gives the district the best overall value. And you can see on that product, you've got Bob Trevino Insurance, Albert Salinas, and Salazar Insurance Group on that product. So there's 3 agents on that product. You're free to select whoever you want on that product, but we recommend Davis Vision because of the superior benefits. I think if you look at, they give us a 3-year great guarantee, which is fantastic. And one thing that I hope we don't overlook in this is I feel like on every product, we increase the benefits for the employees and cut the cost on almost all the products. And you can see the Davis Vision, for example, the benefits are significantly better, and the premiums on employee are $9 and then $7.36 on Davis versus current. There are some cheaper options out there, but as far as the employees' out-of-pocket costs and the value for what they're paying for, we all as a group recommended the Davis Vision option for your consideration. Any questions on that one? Critical illness. I'll go in your order. Let's make it. Y'all just tell me what's next, and I'll do it. Disability. Okay. Are y'all looking at the revised sheet on disability? Let's look at that one.
They have it. And I just gave them.
Yeah, y'all have that in front of you? Okay, thanks. On this one, this is one that Mr. Lamone brought to Janie to take a look at today. And in review, I'll be honest with you guys, I just flat missed it, okay? I missed it. The one I missed was Assurant. They are still not the recommendation because we feel like Aetna's better, but I wanted to own up to a mistake that I made, first of all. I apologize for that. And then I wanted to include it so that they don't get slighted on the analysis.
I'm sorry, I didn't get, what was the mistake that you made?
I just admitted it, Oscar. When I did the analysis on it, I didn't see the Assurant disability proposal, and I admitted it. Yeah, exactly. So I added it to the spreadsheet.
Let me ask you,
Sure.
as far as, I know that you're basing it on prices, which is
Yes.
good. But as far as, we're looking at very little difference
Mhm.
as far as pennies are concerned. What about the services? Do they provide the same service? Or does one provide an exclusive service or?
Well, let's get back to your original question, if you don't mind. First of all, let me just answer the second question. All of these companies have been players in the voluntary benefits for a significant amount of time, and we feel very comfortable with any of the carriers on the disability. So I don't think service to the employees is an issue on this with these carriers. Really, anybody that presented is a good company. They really are, and they've been around for years, so that's not an issue. However, if you look at the Aetna rate and compare it to what they propose, which is the Lincoln, so if you go over 2 columns and there's a Lincoln, so if we were to say we decided just to renew with Lincoln, there's a significant cost difference versus the Aetna. So to answer your question better, Ms. Cruz, if we would absolutely not recommend they just renew with Lincoln, regardless of it's Aetna or one of these other carriers, we would recommend they switch carriers.
This is our current plan.
Right, but then here's another,
Lincoln,
This would be.
yes, sir, it's,
For our current plan.
it's 2 over from Aetna, and we show you the current rates in purple. So you can see it's a significant jump.
it's a 3-year guarantee on that.
And then Aetna's also offered us a 3-year rate guarantee, which we feel pretty confident about, because the fact of the matter is, y'all had some claims on disability. No question about it.
Is there, do you mind,
Sorry.
Is there anyone here?
Somebody call?
Is there anyone here representing these companies right now?
what we're talking?
Okay, Bob Trevino, you, in other words, we currently are with you, okay? So if our teachers renew, your rates are gonna go up?
No, we would, well, if you go with Assurant, we would guarantee those rates that we're giving in the proposal.
Okay.
No, but if they stay with the current company that you're with,
Yes.
they would definitely
It was a
go
rate
up.
increase, correct.
So, see, that's what I was looking at. I was looking at Assurant, and there's a very little difference as far as pennies.
There
are
is, and if
concerned.
you're going to use that for basis, which, look, that is definitely a valid way to look at this, okay?
Okay.
So if you are going to look at that, then we'd have to direct you to principal, because they're exact same rates as Assurant, but they offer a 3-year rate guarantee instead of a 2-year rate guarantee.
Assured will give you a 2-year guarantee rate,
Okay.
and Aetna will give you a 3-year guarantee rate.
And so will principal with the exact same rates as
And
Assurant.
according to our losses that we recently had this past year, if you notice the difference between, that Lincoln is proposing, they've been pretty high, and in order for us to have a rate increase, I recommend that we stay with a 3-year rate for the next 3 years, and it'll be locked in. That'll be that'll be the best thing for the school district, the employees.
Any comments on the representatives that are here?
Well, I just wanted to say, like with Assurant, by the age groups, but the employees that we have, the majority, saving pennies Our chart gives us, it's less expensive. We have about 775 employees, so they would be saving a big difference. I know that some of the rates for the 30-day plan and the 60-day plan, it's a little bit, it's almost the same, maybe a little bit more than ours. I'm sorry, a little bit less than ours, but we only have 179 employees on that plan. So, I mean, I think our insurance still is giving you the best rate for the employees.
You know, and I don't disagree with that, and once again, I'm not gonna waffle on my recommendations. I'm gonna explain to you why we did what we did. But once again, you know, this stuff is fairly nebulous on the voluntary. There's no cut and dried. But that's why if you're gonna use that reasoning, which is a good reason, then you would go with principal just because you get an extra year protection. So if you're gonna apply that reasoning and you're gonna do it, you want an extra year. That's all I'm saying, because the rates are identical, and they're both good companies.
I believe that can be negotiated. I mean, Lincoln gave us, the rates have not gone up, and I don't know how many years, Janie? I don't know how many.
Three? I think it's 3 years. I think it is 3 years.
Yes. Well, but, okay, let's,
Negotiable, they wouldn't have to negotiate with all the different.
hang on
countries.
a sec, Janie.
As well.
Pardon me. Here's the thing, okay? Absolutely right. You can negotiate anything in this world, okay? I agree 100%. But we have to go by, administration, have to go by what we are shown. It's very easy for somebody to stand up once they see the stuff and say, hey, we can do that too. Well, why didn't you? Okay? Everybody had the same opportunity. So I will caution y'all on going down that road. You can if you want, it's y'all's decision, but I would caution you greatly on going that road because everybody's going to stand up and say, hey, if I give my rates to this person, they're going to come down because you know what? They will. No doubt about it. I mean, if you wanted me to go out and do best and final offer, these all would come down, but we don't have time for that. So we've done a good job with the time frame that we've been given, and I would recommend that y'all don't go down that rocky road, because believe me,
Excuse
it's
on the
rocky.
proposal, it is 36 months. I think that is 3 years as well.
On the Assurant?
Yes, I have it with me.
No, we looked at it today, it was 2.
I didn't look at it, you did.
Yeah, Lucy looked at it, it's 2.
It's 36.
Well, we'll get the proposal, I can't take a handout. We'll check that.
I'd like to get a copy of that. Can we get a copy of that, Mr. Lima?
Yeah.
I'll make sure you get a copy of the proposal that was turned
Right,
into us.
yeah,
We'll get the initial one, right? Not.
Right, the initial.
Okay.
right, yeah, we have it. Okay,
Boss, I don't think we should be allowing forms from the audience.
Mr. Garcia, would you explain the process to us of the bids that came in or the proposals that came in and what we're doing now that's going to be out of there?
We can't be asking the audience for input. These are proposals that were received and evaluated. No, okay, my proposal, we can do this extra. No. You can have lawsuits and you can.
All we're asking,
What it was done,
But is
it's
it a
done.
workshop?
it's a workshop, Mr.
It doesn't, so.
We're not-
I think what he's saying,
Here.
I think what he's saying is that it's going to invalidate the evaluations that were already conducted because they were
It's like
sealed
it's a
proposals.
subpoena. They subpoena you, they take your testimony, but they take it to court.
Can you just repeat, is there a specific question that,
They're asking audience members that are representing these insurance companies for information, but Mr. Garcia is telling us that they were sealed proposals, so we
well,
shouldn't.
as long as the purpose of the workshop is to get more information and clarification, but the numbers can't change because it was the RFP, so at this point, we're not in a position to accept different numbers than were submitted, and to the extent that the audience comments or informations and questions or clarifications, it's fine to take that information, but we can't change the data that was submitted. Or we can't let the comments amend what was submitted. But it's fair to ask questions in a workshop.
well, and I think.
That's basically what we're trying,
Right,
that's
that's all.
basically what we're trying to ask.
No,
We're trying to understand everything.
Right, and keep
You
asking the
know.
questions, because my only advice to you is, hey, let's look at the proposal, and if it's wrong, we'll change it. We want it right. That's simple. We're not gonna take handouts from the crowd, that's just bad business, but we do have the documentation, and anything that y'all bring up that's, you find that's incorrect, that's what we're here for. Raise your hand, we'll check it. We want it right, okay?
I just checked it right now.
Well, I know, but I mean, it's, documents can be different. We have to go by what we get. And we'll show these people and you at a later time what we have.
Mr.
It's not a
Hilliard,
problem.
I think that with all due respect to who's in the audience and all the members that are here, I think that it's not good business if you weren't checking with them prior to you even coming here. It's obvious that she's got a 3-year plan and you have a 2-year plan, so something's not right. And I'm not taking her proposal. I understand your numbers and I get them and
Right.
have them here in front of me, but you seem to be bothered because she's telling you she's got a 3-year plan.
No,
And that's fine,
No,
but.
if you heard that, you didn't listen to me.
Yeah.
I said,
I'm listening what you're saying, sir.
I said, we would check it, and all I want to do is get it accurate. That's all I said. All I said is we can't take information from the audience. We can pull any RFP you guys want to look at it. We can look at it alone. We can look at it together. We can do whatever you want. That's
So
all
you
I'm
weren't aware
saying.
that Assurant had a 3-year proposal?
No, I put it down as 2. I checked that with Lucy this
You were.
morning. That's what we have. But if it is changed, if it is 3, we're going to change it. We're not trying to hide something. We want it done correctly.
And that's the reason, I'm
Absolutely.
glad we're asking questions.
Right.
and-
And that's great.
and-
Ask them.
And if
It's
the people
just,
are out there, representatives, yes,
Right.
I want to hear from them too. You
Right.
know, I don't
And-
think we should be making mistakes like this either, because this is a serious matter. Cafeteria plan, that's a
oh,
lot of money.
I agree, but I'm just saying we don't need documentation from the people out there.
He should have it with him if he's presenting
Yeah.
insurance as well.
It's in the office. We
Mr.
can get it.
Cabrera? I mean, we don't need to see anything other than we're
You would need to
questioning, we
file
want the
if-
information,
Right.
and that's it.
If
All
you've
we're
got,
asking is for additional information if there's
Right.
any. That's all we're asking.
Not from the audience.
if there's a,
Well,
there's-
we have an attorney here, Adrian.
If there's a
Let him-
complaint-
it's
I
okay.
know my purchasing rules are law. You don't ask for additional information from the audience.
well, listen, if there's a formal complaint in the way that the process was handled, then the process is to grieve to the purchasing manager, and then we can review that and make sure that everything was included or that the information was presented appropriately. But the appropriate place to do that, other than giving information we discussed earlier, would be to grieve to the procurement officer, you can copy the superintendent, and then we can investigate to make sure that the RFP was handled appropriately, if that's the case. But certainly, we can't change the numbers that were submitted in this meeting.
Go ahead, sir.
Okay. Can we talk or can't we talk?
I mean, it's an open workshop, the president holds the floor, but the workshop isn't governed by the rules of a, Open Meetings Act with a board meeting.
We already have previously allowed questions from the audience, and I don't see why tonight we can't allow them.
I think,
Just wanted to make sure that the gentleman on the podium understands that we can talk. We clear?
just to sum it up,
It's their meeting, as far as I know, belongs to the board, citizens of San Benito, and not anybody else. But they call the shots. Correct or not?
Absolutely, sir. The only thing I'm saying is we can't take stuff from the audience. That's it.
Mr. Cabrera, and correct me if I'm wrong, I think just to sum it up, we are open to listening to the community's input, but when it comes to receiving documents from the audience, we're not going to do that because it would invalidate the bidding process. You did receive sealed proposals, am I correct?
Yes.
So we don't want to invalidate any of the information that was received and reviewed. Now, when it comes to the information that we did receive that was revised, I know that there's a question as far as the 2-year and the 3-year. That even if it's a 3-year, it doesn't change these numbers.
Correct.
So then it's still higher than the recommendation, correct?
It is, that's correct, but then you would have 2 companies that are identical instead of one that's being evaluated separately because it's got a 2-year rate guarantee. Once again, we need to find out what it is, and you'll get it, no doubt.
And even then, the difference is just pennies. It's not really that much of a difference.
No, it needs to be accurate,
But no,
though.
yeah.
Right.
But
No.
it's,
So that we can't talk.
You are welcome to provide input as long as it's within reason and that we do maintain order.
Okay, so we'll get that information for you. Okay, the term life, we did revise this quote, and I do have this to at least pass around to show you. This was brought to our attention, but it wasn't presented under term life, it was presented under lifestyle life, and I have a copy to show you. So that certainly shouldn't keep it from being excluded, because I think the intent it was term life. And you can see the rates are considerably better from our previous recommendation. So our recommendation on this would be Bob Trevino with Unum Insurance. Any questions on that? Okay, the next one's the cancer. Well, what's your next one? I'll go to y'all's. Yes. Okay, on the cancer one, the current plan's with Allstate, and once again, if you look at these benefit levels for each level, you can see that they're considerably different. So you really have to go on best value. Did y'all find that one? Did y'all find that? You good? Okay. You have to go best value on that. Once again, you can see that the rates are slightly better on the low plan than current, and considerably better on the high plan than current. So that's why we recommend a Colonial. They have excellent benefits and excellent rates. And that's with Salazar Insurance Group. Have any question on that? Okay.
Once again, I will address the people that are representing that company. Is this accurate?
Well, we also put in a bid, I don't know if our name would be there, Glenn, but we also put a bid with Colonial.
There was a Colonial bid that was presented. It definitely was. Because there was 4 RFPs, and we met as a group, and we disclosed it to the agents that attended that meeting. They'd only submitted 1 copy, and the bid specs called for 2 copies. So the Colonial was ruled inadmissible because it wasn't an incorrect bid. This Colonial looking at was contained inside of another bid. Okay, and we have documentation on that as well. There was 4 bids. There was a Sun Life, the same way that 3 people were on, and there was 2 TPAs that came in also with 1 copy. So she is definitely correct. It did come in with Bob's name on it, but we could not accept it because there was 1 copy.
Okay.
Anything else? No? Okay, the accident plan. The current plan's with ING, and we're recommending First Financial Bob Trevino on this one. Once again, these plans are all over the board, but we figured this was the best value for the plan submitted. And you can see that if you look at the premiums, you've got some cost savings on there as well. Anything on that? Anything else? I think that's it.
You know, once again, the prices, there's very little difference in prices. So, you know,
Well, I mean, you're right, that there's a small reduction in prices, but, you know, there are some additional benefits, and I think with employees that don't have a raise, you know, we should at least recognize the fact we can bring them better products at lower pricing, and we're fortunate and blessed that we have the ability to do so. So, you know, once again, these are just our recommendations, okay?
okay.
Mr. Hilliard,
Yes.
do you know who Salazar Insurance Group is?
Yes.
You know them?
Yeah, I know all the agents.
Do you realize that Salazar Insurance Group is the same company that that the letter that Ms. Rodriguez wrote, with all due respect, Ms. Rodriguez, on May the 16th, making them immediately the sole agents handling all medical and dental stop-loss contracts. You remember this letter?
Of course.
Who wrote this letter?
I have no idea.
I did,
You wrote this
I
letter.
did.
Who authorized you to write this letter?
I was authorized by the board president.
By the board president. Mr. Hilliard, that's the problem that I have.
Well, just for the record, though, that letter was retracted.
It was retracted, but it's relevant for today, and I'm asking the question for my part, because I think we have a right to know.
Okay.
And that's the problem that I have here,
Okay?
that on Tuesday, Mr. Hilliard, this is what you gave us,
Okay.
right here.
Yes?
This is what you gave us.
Correct.
Okay? Very unprepared, lack of information, if you will, okay? And that's just my opinion. And this is what you're giving us now, okay?
Yeah, I gave you what you asked for.
Do you see the difference?
Of course.
Okay. When you spoke to us on Tuesday, you never mentioned Salazar Insurance Group.
Of course.
Why didn't you?
Well, because A, we didn't get through the whole presentation, and B, nobody asked me.
Yes,
And this-
you did, sir.
This, from our point of view, okay, now this might just be my point of view, all right? And I'm entitled to mine as you're entitled to yours, okay? I don't care what agent you use. It's not a big deal to me, okay? What I care about is delivering you the best product, which is what I did in my
Mm-hmm.
analysis to show you. The agent to me is irrelevant, okay?
Well, it
They
should-
all-
well,
They all do
it
a
should
good
be.
job. Bob
It
does a
should
good
be.
job. Mr. Doug Banks with First Financial does a good job. Bob Tremino does a good job. These people are all veterans of the business.
And you're right. And you probably know all the insurance agents.
I know every one of them.
And I believe that as a board, you were hired to look out for the best interest of our school
Absolutely.
district.
Absolutely.
Do you agree with this letter that went out on May the 16th?
Mr. Medrano, I don't have any opinion on it at all. It's not my letter.
Okay,
And I don't need to have an opinion on it.
Mr. Cabrera, can we deviate from the workshop if we're looking at evaluations and now we're?
It's relevant to
looking at
me,
If I can make a statement before y'all continue, this, first of all, I'd like to apologize for being late, something happened with my son, so that's why I walked in. And what I want to go is, I looked at the numbers on the workshop, I studied them, and that letter, I understand that it was given out, but I think that letter needs to be, you need to basically
No,
ignore
ma'am.
that, but it has nothing to do.
Yes, it does, ma'am.
But if
It
you
does.
look at it,
It does,
you're-
Ms. Aguilera, because now.
But you're jeopardizing a
No,
company
ma'am.
because of something that was
No,
done.
I'm not jeopardizing it. I'm asking the tough questions that maybe some of us don't want to ask. And the bottom line is, I am looking at these proposals, Mr. Hilliard, and if I could finish, okay, I'd appreciate it. And everything benefits Salazar Insurance Group, okay?
Okay?
Let's be honest here.
Well, I don't see that.
I
There's
see
several.
it. I
Well,
see
do
it
you want to
there.
go
Several
through?
there for Bob
You want to
Trevino.
count them?
And what I'm telling you, sir, is that I'm trying to go back to this letter that went out to all the companies. Who sent this letter to all the companies?
I mean, I'm sure the district did. I didn't.
Oh, you did it?
Not to the companies.
Then how did the companies find out that Salazar Insurance Group was going to be the sole agent, effective immediately?
I think you're misunderstanding.
I'm just asking a question.
Well, I'm answering it, okay?
So you don't know?
No, I don't know it. It's not my job to do it. I just went, I know these people, they say, hey, we have a letter, can you come pick it up? I brought it over, I immediately met Mr. Lamone and say, hey, here's what we have, correct? Immediately. That's all I can do.
And that's the problem that I have, Mr. Hilliard, that now, come Tuesday, all would have been fine. Be upfront with us. Tell us that Salazar Insurance Group is involved in this process. And you never, on Tuesday, even mentioned the name Salazar Insurance Group. In fact, you give us a document that has none of the companies listed, Mr. Hilliard.
Right?
And as you said earlier, for the purpose of integrity and so forth, why weren't all the companies listed?
Okay, I'm going to answer that for you, okay? In my business, okay, that happens quite a bit where you don't show the agents. It's standard operating procedure in the consulting business not to show that, so then the board members are not forced to confuse the facts, okay? We give you the best product, And I would have answered that question. We never got through the rest of our presentation. Y'all said we want to see everything, and what did I say? I said, you know what? We have everything done. It's already prepared. Let me bring it to you. That's exactly what I said, and that's what we're doing.
You said you had over 150 proposals that had come in.
We do.
That's what you all said.
We do. But you got to
That's
keep
what
in
y'all
mind, a
said.
bunch of them are multiple, and a bunch of them are stuff that we don't look at.
You neglected to provide us key information on this bid. And if we're talking about transparency, like you mentioned earlier, because I believe in transparency, Mr. Hilliard.
Well, I think
Let me finish. There was no transparency on Tuesday.
that's because we weren't
Okay.
finished with the process.
No, sir.
Yes,
No,
that is
sir.
true.
No, sir.
We did not
You were
finish.
bringing us the bids already. You were bringing us the proposal, sir, right here. It's right here. And there was no transparency, sir.
Well, that's because we
transparency.
were going to address it later. I was
No,
going to
sir.
show you, don't
No,
tell
sir.
me what I think.
No, sir, I'm not
okay?
telling you what you
Yeah,
think.
you are.
No, I'm
You're
not.
putting words in my mouth
No,
now.
I'm not
I'm
putting
telling
words
you
in your
what we
mouth.
had
No,
prepared
sir.
to discuss.
Mr. Medrano, okay, bottom line is, we did have the Finance Committee meeting. He did go over numbers. There was no mention of TPAs or anything like that, but I do recall, we did ask you that question.
Absolutely.
And you did say that it's irrelevant to you. He did mention that fact. Then we went ahead and we requested to have another workshop, and that's why we're here today, because we're looking at now specifics, as
Right.
requested by the board at the Finance meeting.
But board
Make
members,
sure and let them know.
I'm asking you, isn't it a red flag for you all when he did not mention Salazar Insurance Group?
Well, the
Mr.
thing is, Mr.
It's not a red
Cabrera,
flag.
I have a letter from you where we're clearing that, and now we're looking at numbers, am I correct? When it comes to that letter that was retracted, I have a
Yeah.
letter from you.
I think to the extent, Mr. Medrano, that what you're trying to say is that the other information you mentioned potentially affects your opinion of what we're presenting today. I mean, that's your opinion, and you're welcome to state that, but it is a workshop just to review the bids that came in, to better educate the board about what, so I think that if, with all due respect, Mr. Medrano, I think you made your point, and to the
No,
extent
and
that-
I'm done.
Okay.
I just needed to give my 2 cents worth. If this board feels that this particular, the system, the way this was presented since Tuesday was transparent, if in your honest truth, you feel this was transparent, I certainly don't. I don't. And that's why I'm letting you know how I feel, because it is relevant. It's relevant, and we gotta do what's right.
I think it's relevant, Mr. Medrano, and I will say that, but the fact of the matter is that you think that there's something going on behind the fact that Salazar Insurance Company, but I think everybody will agree here, we do live in a small town, it's kind of impossible not to know a lot of people, but I'm just saying, if or if not, he's known, but there's other insurance companies that have put in bids of people that we know. We have, Mr. Claudio, apparently everybody knows him in San Benito, but that doesn't it's not saying that he's gonna do anything, he's a man that has a lot of integrity, I'm pretty sure you know him.
Absolutely.
And with Mr. Claudio, let me interrupt real quick with Mr. Claudio. He did present an RFP on some products. However, we did receive a letter from Allstate, directly from the Allstate Vice President, stating that Mr. Claudio would not be an agent, that it would be
Yeah, we got that.
given to Bob Trevino.
Okay, I
See,
think
and it's-
Allstate is here right now.
We have
and
a
I'd
question
like
in
to
the
hear from
audience,
them.
or a comment? Yes, sir.
Respectfully, my name is Doug Banks. I'm employed by First Financial. I represent TASB this meeting tonight and Mr. Claudio. We discovered late this afternoon of that letter. We promptly called the president of Allstate American, and we have not got an answer yet. We're not sure how that letter came to be. We don't know who began the letter. However, we don't think it's correct. This is the very first time in my 27 years working for this organization to have Allstate have only one respondee to any RFP that they put out. We represent over 450 school districts in Texas with the impeccable reputation of TASB, the TASB Supplemental Employee Benefit Program.
Mr. Banks, let me,
Respectfully-
Excuse me, can I,
Oh, go ahead, go
Mr.
ahead.
Banks?
One
Sorry.
moment, Mr.
I
Hilliard.
respectfully suggest that you review the TPA programs and look at them again, and perhaps have a workshop for the TPAs. Let them run the programs for you. It's the engine that makes the insurance carriers work. We represent over 125 different insurance carriers, including every single one in this room. And I'm certain, although I haven't seen the RFPs, every single one you got a response from. So I suggest to you, ladies and gentlemen, it's the TPA that runs the boat. We respectfully say, we'd like to drive your bus and take it to TASB in an impeccable fashion. Thank you.
Mr. Cabrera?
I just want to clarify, again, going back to some of the other comments, and we will do this in the future. I think the purpose of the workshop was to educate the trustees. They had quite a few questions about what was going on, and then in having transparency, it's an open workshop, public can attend, but I do want to be clear, while we didn't state these rules, and we will next time if this comes up, this is not a place for you to advertise or to clarify your bid or to promote your company. That's not the objective. The objective is just to give more information to the trustees to help them learn about the process, what decisions they're making. So if we can please just keep the meeting to that, to the objective data or questions about the RFP, but with regard to the process or whatever else handled, we need to file a grievance or a complaint with the procurement officer, Mr. Garcia, and then we'll handle it through the appropriate channels if you don't believe that the RFP was handled appropriately. But this is not the forum to advertise your company or to try to promote your company. We just want them to be able to review what was already submitted in a bid and get more clarification on the information. That should all, that the workshop should be limited to.
Mr. Cabrera, I have a question, sir.
Yes, sir.
Regardless of the plan that the board may choose or not choose, isn't it true that any agent that the board chooses can represent those companies, that it does not have to be the agent that presented the plan?
It's a little more complicated than that, but basically, yes. I mean, there's some other steps that we'll have to go through it. And, there's relationships between agents and not all agents represent all companies. So that's part of the problem. I mean, the agent has to have a relationship with a particular insurance company. They can't just walk up and go represent somebody. So assuming that all the agents you're looking at represent the companies you'd like to choose, then that would be a true statement. But we wouldn't know that looking at what we have here. Does that make sense? In other words, all agents don't represent all companies. That's why they submit their bid with certain companies in their basket, if you will.
But if there's multiple agents submitting for the same company, the board can choose the agent that they want.
Now that also goes back to the way we wrote the RFP, so it's a little more complicated. But generally speaking, depending on how you approach the process, I don't think this RFP was set up for that, though. So it wouldn't be something we could do out of this particular process. You could choose an insurance and where you're at at a later date, decide you want a different agent of records because you weren't getting appropriate service. You've got the right to do that.
Okay, I guess my next question is, how do you choose the agent?
Typically, the way organizations do it is that they come along with the products that they present to the district. Districts don't typically choose an agent separately from, I'm just giving you separately from the products.
In this case, since there are several agents that are being recommended according to the different plans, you flip a coin, or what do you do?
Well, right now, you've got to accept the bids the way they're brought in by the agents is what you've got to do, because that's the way the bid was called. See, we control the process, we being Mr. Garcia in your district, in the way you write your RFP and the way the responses come in. So if you don't like the way the responses come in, many districts, and it's very often, do not select a bidder to an RFP because maybe they didn't like the responses or they feel like maybe they didn't write it tight enough or specific enough to meet their needs. It's very common for a district to decide to go back, meet with the procurement officer, more clearly define their RFP and go back out if they don't feel that it meets their needs. That's a common practice. Is that correct, Mr. Garcia? I mean, it happens all the time. And it's not anything, it's just sometimes districts aren't happy. Maybe in retrospect, they say, we didn't create this correctly, or maybe we wanted actually something different, or maybe the bids didn't meet our needs, and it goes back to the beginning we've talked about. It's very important in these situations for the board to clearly tell the procurement officer what they want, because then the procurement officer writes the RFP or the RFQ based on the needs of the district, what's in the board record. So it's very important that we clarify that. Some are easy, right? I mean, if this is a more complex RFP, but if you went out there and buying uniforms for your maintenance, that's pretty easy, right? You're not going to make that mistake. But in this one, it's pretty complex. There's a lot of moving parts, and that could be part of what's going on here.
I'd like to say a few words. As you all know, I am Janie Gonzales, and I am the risk manager for the
I just don't know if Mr. Garcia wanted to add something, just to that comment, Janie, so we stay on the same theme. If
Go
he,
ahead.
My comment here is that for us to go out for proposals, the superintendent gave me a directive, or should we say it was an agenda item? That is correct. it was in June, to go out for a TPA and voluntary, right? That is a way to do it. You have to go out and have sealed proposals. This is the procedure we took. What happened before then, back in late May, we all know what happened, right? Somebody wrote a letter, and big retracted and everything. Okay, hey, let's do it right. Let's do it right. Let's go out for proposals. We went out for proposals, we received them. Whatever we received on that day has to be evaluated. The consultant was hired to evaluate the proposals. We gave some input to the evaluation. And this is the result. Now, who do you give the contract to? Do you give it to First Financial? Do you give it to Pete Claudio? Do you give it to Bob Trevino? Do you give it to the Salazar Group? Well, it's only fair that if the Salazar Group, if they submitted 10 plans, Salazar was low bid on 6 of them, Bob Trevino was low bid on 3 of them, somebody else was low bid on 1. It's unfair to give 9 bids to the 1 low bidder, to the agent. I'm talking about the agent. That's my feeling. Who are you gonna give who submitted the better plans? Not for us, not for the district, but for the employees of the district that are gonna be paying for these plans. They will be paying for the plans, right?
So you were okay, Mr. Garcia, with the way this process was handled since Tuesday?
Yes, there was no real tight guidelines for the selection. You know why? The selection is not made by us. The selection is made by you all. You all need to figure out who gave us the best products that we're asking here, which of the employees are gonna be paying money out of their pockets to pay for this cancer insurance, disability. It's the employees that are gonna be paying for it. Who gave us the most product? Whether Salazar can be a player or not in this RFP process, I think he can. That's my opinion, because you opened it up to everybody. Everybody can play this game. It was advertised, everybody, we had an enormous amount of
Bids that
proposals.
came in.
You think he can, Mr. Garcia, because you're not on this side of the podium.
Well,
See? You're not in our position where we have to respond to the community and to our
Yes,
taxpayers
sir.
And that's where I come in.
Newspaper.
on credibility.
And that's why we're here evaluating numbers.
Yes, I'd like to
Ms.
say a
Rainey?
few words. As y'all know, I am Janie Gonzales, and I am the risk manager for the school district. And I'm sorry, I'm getting a little emotional about this, but we have worked so hard on this. And my job as an employee of the school district is to do what is best for the employees of the district. And I am telling you right now, this is all transparent. We have not fabricated any numbers. We have not made up any names. We have not made anything up that we are being accused of. And I'd like to have your respect to please honor our recommendation, and let's move on forward. I have to deal with these employees on a daily basis, just as Lucy does. We are short 1 employee. We are now just 2 employees, and we have to handle the staff. It is a very difficult job to do, but we will do it. I will do whatever you recommend. However, I would like to recommend that you go with our recommendations. This is hard work. We have done what is best for the employees of the district. And my heart is there. My heart will always be there. I have been doing this for 18 years, and this has never happened in my department. For me to be judged, for me to be said that I'm making deals with agents is unjust. I have a reputation to keep. And my reputation is for my family first. Therefore, if you don't go with this recommendation, I will honor it. I understand. And I will guarantee you that the job will be done regardless if you go with my recommendation or not. Thank you very much.
Yes.
Let me add
We have
something just real quick, and we'll get right to you. No offense. But Mr. Banks, Mr. Claudio, I want to let you know that my stance and the district's stance is that we can pick any agent we want for this process, and it was actually in the RFP. So I did not take your name off the list or off the processes at all, because in my opinion, you're a licensed agent for Allstate. If Allstate's awarded the business, the district decides they want to hire you for their agent, you can do the job. That's all we worried about. We did not take you out of consideration at all. Just want to get that on the record.
We had a comment from an audience member.
I think I don't know if I misunderstood your consultant to say that when you were giving numbers and figures, names were not important. I think name recognition of companies is very important to tie in with your figures.
Right, and we recognize that, and that's why we called the workshop, to give us more in-depth knowledge as far as what was being offered and the recommendations that were being made. So that's why we held this workshop. Mr. Hillier, I understand we
Okay.
still have two other items we need to look over, critical illness and hospital indemnity.
Yeah, that's right here. I thought maybe we got interrupted on this one, but the critical illness, you grab the hospital indemnity if you don't mind, Janie. I didn't see that one in here. But the critical illness is the Lowell American under the Salazar Insurance Group. And then the current plans with ING. You can see that, they have the full coverages. And once again, the premium is extremely low on this plan. And we feel like it's the best value for the school district. And SIG presented this proposal.
You all needed their critical illness, correct? That's what you're talking
I
about?
think you're looking for the hospital indemnity, correct? Yeah.
Oh.
Let me check something just a sec. We'll have to get a copy. Will someone manage your? We're gonna get a copy, please. Okay, the hospital indemnity. The current plans with Allstate, and you can see the recommendations with Colonial, with Salazar Insurance Group. And once again, they have increased benefits, and the price is significantly lower than the current plan presented. Any questions on that? Anything else on this?
Thank you, Mr. Hillier.
I'll check the other proposal and have you all have that for you at the board meeting, if that's okay. I'll make copies of where the documentation is either way, so you'll have it. Thank you.
Thank you, sir. Moving on to item number 3, presentation and discussion of proposals for the third-party administration services for an additional major medical insurance plan option.
Mr. Garza?
Superintendent Limon, Ms. Rodriguez, thank you very much for the board, for the opportunity to go in debt. We spoke last week, and upon your request, we're providing more detailed information in reference to the care management plan, which would be an alternative plan for the employees currently under with Blue Cross Blue Shield. So it's not in replacement of, it's an addition to, okay? For our employees, the strategic highlights, the main thing to remember is the plan is going to only cost $25 per month for the employees. Very cost effective and affordable program, and it's going to allow them to access primary care, specialty care, in and out patient services, hospital care, and they're only going to have a deductible of $250 a year with this program. In-network is 100% covered all across the board, so employees has no co-pays for all above services. The membership highlights, we anticipate 700 members to join this program, and we're going to go a little
Richard,
bit more in
Can
depth.
you give us a page number, please?
Oh, yes,
that
I'm
you're
sorry.
looking at?
We're on page 1. We're going in depth over for our employees, the highlighted items. And this is more of an overview, and then we're going to go a lot more in depth in each one. We anticipate membership of roughly 700 employees, and we're going to go in a little bit more as far as how we came to that number. And the saving highlights, this to me is big. The managed care plan, design and care management service under the plan has conservatively projected $600,000 in annual savings to SBCISD. Looking ahead, innovative methods, not one just as far as providing cost savings to the school district, but as well providing affordable access to health care for your employees. Not only that, staying above the trend and the changes and the financial impacts that are coming with the Affordable Care Act. We flip to page 2. We're going to go a little bit more in depth to the enrollment plan and how we got this number of 700, okay? Currently, right now, you have employees covered are 1,433. You have 928 dependents for a total of 2,361. The way we came to the 700 number, as you'll see under memberships on the second part, is out of the uninsured, which is a total of 400 total. We anticipate a 50% enrollment of the uninsured, and we project a 20% migration from the employees and dependents from the high and low plan to this plan. So just when you know where do they get these 700, this is a little bit more in depth what we anticipate. Every number here is conservative, okay? The only number here that you see as far as projection in cost savings is the membership of the employees, okay? Everything, we have 700 employees sign up. Everything that you're going to see as far as additional savings are instant. These are not projected. These are not down the road. As soon as this plan goes into effect, you start saving money. Managed care savings. Managed care savings allows the employer to minimize exposure to unnecessary health care costs through a variety of mechanisms, including economic incentives for physician and patients to select costly forms of care, program and reviewing medical necessities of specific services, controls on inpatient admission, length of stays, established cost-sharing incentives for outpatient surgery, selective direct contracting with healthcare providers, and the intensive management of high-cost healthcare areas. These two right here are the most important things, the next two topics, and one of them is the savings, okay? How we anticipate these savings, there's 4 different methods. One is a discount on the TPA administration fees, direct negotiated rates with all medical providers and services, care management services through medical community management, and savings through reinsurance services, which is your stop loss, okay? That's how you as a school district save monies. Now, how does it affect the employees? To me, this is totally tremendous. I'd like to, one, start off with a $25 a month access to care, very affordable, okay? They only have a $250 deductible. That beats any plan there right now. There's no copay for the on-site clinic, which is in existence right now. There's no copay for specialists that are in any of the networks. No copay for any hospital services, and no copay for Tier 1 prescriptions, which are generic and some brand name drugs. And the reason I say this is very important is currently under your existing plan, generic drugs are 100% covered, but you have some other drugs that are not 100% covered that your employees need access to maintain their chronic illnesses, to alleviate the financial impact on you. So this program allows them to obtain hypertension drugs, diabetes drugs, any drug that's not a generic, it allows them to obtain it at no cost to them, which in turn allows them to adhere and become compliant with their illness, which in turn saves you money from them preventing ending up having to go to the emergency or catastrophic event. Thousands of dollars in out-of-pocket annual savings. Right now, when you look at the deductibles, when they go to the networks, when it's primary specialist, your annual deductible, your co-pays, excuse me, when I said not deductibles, your co-pays for your primary specialist, and your prescriptions, you're saving thousands of dollars instantly for your employees. Next page, page 4, is kind of more of a visual aid how this program works, so we can have a little bit more understanding. All the employees and dependents would go to the on-site clinic. The on-site clinic, no deductibles, 100% covered. We refer to a group of specialists, and just to let you know, one of the main concerns that we had last time was access to care and the provider list. We have over 1,012 specialists in our program, 283 ancillary services, and when you go over, we have all major hospitals in South Texas and throughout Texas covered as well. We're going to go a little bit more as far as in depth on that as well. We can turn to the next page, page 5. I'm a firm believer talk is cheap, and this here shows exactly how we anticipate the $664,000 in savings. Currently contracted with TPAs to the first form of cost savings is through your TPA administration. Currently right now, there are several TPAs that are willing to do your business, willing to obtain your business, excuse me, and to provide a $10 per employee per month savings, okay? And when you calculate that, you come out to $84,000 in savings. This happens as soon as the plan goes into effect. Direct contract, okay? Direct contracting. We anticipate 12% in savings out of the medical fees that you currently pay right now, which is $480,000 in savings. That happens instantly as soon as this plan goes into effect and we're able to utilize the direct contracting. Reassurance, 8%, that's $1,000 from the stop loss that you in turn end up saving as well. These numbers are very conservative, and we anticipate a $664,000 savings throughout the year. It's not just about the savings, but it's about the program and access to health that you're able to provide to the employees as well. Now, just to give you an overview, on the last page, which is page 6, this is very tremendous, and I would be honest with you, I put Mr. Limon, Janie Gonzales, and Glenn Hilliard's name on there, because when I saw this, I was totally impressed. 2006 and 7, these are broken down by the years, as you can see. We have your total cost, okay, for health care. We have your total contribution, and we have your profit and loss. 06, 07, you see the number that you're at, okay? Matter of fact, that's actually the year that your on-site clinic went into effect. And I definitely have now no doubt that this is one of many things that they have actually implemented and come up with that has allowed you to remain in the black as you see the following years. We also put a little chart in there so you can kind of get a little better visual aid as far as what's coming in and what's going out. But to take it from that deficit, to take it to where you're at to now, with the increased cost in healthcare, y'all done a heck of a job, a great job. Hats off. Next page is kind of a copy of the plan overview. I think y'all received this last time. I think this is one of the only documents you received last time. I believe it's up for review. If y'all have any questions in reference to this document, please let me know. Any questions? No? Now, going back to our providers and our access to our networks. With the first page you see here is a zip code list throughout Texas of all the providers and services that we provide through our network in Texas. The highlighted one, 785, is the Rio Grande Valley, okay? If you were to do a PCP network, which we utilize the on-site clinic, you'd have 733 primary care specialists. We have 1,012 specialty providers. We have 9 hospitals, 283 ancillary services. So one of the big concerns and questions was, you know, who are the providers? Are they going to be on the network? So what we did is we did a breakdown list. The first list contains the hospitals and the ancillary services. and then you keep going till you see a yellow page. After the yellow page are all the providers in the Rio Grande Valley that are on this network, okay? This network here, anybody can participate, as long as they're adhering to the standards that you're requiring from them as a medical provider. And that's taking the most cost-effective route of healthcare without compromising the quality of care. Definitely want you to keep in mind that on a national level, your medical community throughout South Texas is the highest, not just in the state, but in the nation. Any questions that you might have in reference to anything we talked about here? We took all the concerns that the board provided. We put everything into detail, and we're presenting it to you now. If there's any additional information, any additional questions, please feel free to ask.
So they'll be able to use all these hospitals that are
Definitely.
here?
Yes, sir. They definitely will. Then we do
And-
management oversight as well.
And the doctors, all these doctors that are.
That's correct.
At the end of the day, Mr. Garcia, how much is this going to cost us to have this plan in place?
Actually, not a single penny. As far as the care management aspect and everything, these are services that you picked up through our company, managing your on-site clinic. On-site clinic is one of many services we provide that we have in our repertoire. You are able to utilize our services and at not an additional cost, at any cost to you. So when it comes down to it, there is no cost. It just cost savings.
So what you're saying is that on-site clinic will swallow the cost, if you will, of the program to incorporate it?
Well, actually, what it is right now, you're funding the on-site clinic at cost plus a management fee on top, okay? When you take the on-site clinic and your primary care medical community and their costs for your visits, yes, the whole point is to utilize your primary care, your investment that has been proven in saving hundreds of thousands of dollars to continue saving hundreds of thousands of dollars for you.
Did we ever get the list of how many employees are without insurance? I know we wanted to get a list.
No, I'll be honest with you.
I know we said around 400, and I had questioned that, and I don't know.
I tried, well, actually, there's 200 uninsured that opted out, and then you have 200 that are accounted for. And through my research to identify how do we capture these people, the only alternative I had is during sign-up, when it's very imperative when you select your agent and your agent actually comes in and they do the sign-up of your employees or the actual enrollment. Excuse my verbiage, I'm not an insurance guy, I just know how it works. The actual enrollment aspect of it, these individuals should have been accounted for. You should have been able to identify where they're at, what they're doing. So no, I can't answer those, but those are something that in this next enrollment, we definitely want to address an issue and make sure. Keep in mind, this is not just measures of cost savings, which is generating revenue for you, but passing on an affordable product to your employees. This is addressing an issue that everybody's going to have to address with Affordable Care Act coming out in 2014. Now, when you hear about the Affordable Care Act, you understand that there might be some issues with Medicaid, but as far as Affordable Care Act and the mandatories and requirements from the private sector, which is your insurance carriers, those still go into play. Right now, we can't deny children. Next year, you can't deny adults. The following year, everybody has to be insured, so.
Did I hear right? Did you mention this is through Blue Cross Blue Shield at the beginning of your presentation? What
No,
did you
this
say?
is this is
This
a
is
health
separate,
plan
right?
that's parallel to them.
Parallel,
This does not replace them.
Okay.
This is parallel to them. It's an alternative, affordable option for them. And that's what we're bringing to the school district.
And we would, if we go through this, with this plan, we would need to hire a separate TPA. Is that correct?
Definitely. Any move you make, you have to hire somebody to administer, which you're currently doing right now. To administer and pay the claims, and that's the process because you're self-funded.
I know did we ever ask Blue Cross Blue Shield?
If the board approves the proposal to go out for a third-party administrator, all of Blue Cross Blue Shield and anybody else that wants to submit that's qualified will submit, then we'll evaluate that, then bring it to the board at a later time for the board to approve whether they want to do it or not do it.
The TPA is paid when a claim is processed, okay? A lot of our programs, cost saving, happens before it even hits the TPA, so keep that in mind as well. A lot of the care management, I mean, these are very conservative cost-saving numbers, let me put it that way. And there's a lot more additional that's on the table as well, as far as cost savings for the school district.
Well, I will say this, Mr. Arce, this is a lot more information that you presented on Tuesday, so.
No, definitely,
A lot
no
more
doubt.
information.
I came prepared for what I was instructed. The board instructed to provide additional information. This is what we do, this is how we operate, and thank you for the opportunity, actually, for allowing us to come back and go a little bit more in depth on this program.
Are there any other questions? Thank you, Mr. Garza.
Thank you very much.
Which brings us on to item number 4, adjournment. The time is 6:49. We are adjourned, and we will resume with our regularly scheduled board meeting at 7 o'clock.